I started gaining weight when I was roughly 5 years old and ballooned up to over 600 pounds at the height of my weight. I found out I was diabetic when I was 32 years old. What occurred was I didn't know what the symptoms were at all. I was actually running to the bathroom like every 5 minutes and getting the cotton-mouth system and just really lethargic. And this was when I was probably over 600 pounds and didn't know what was happening. And I drove myself to my doctor and wasn't feeling good and told him my symptoms. And he actually admitted me to the hospital due to the fact that he saw the signs of diabetes and was very scared that I was in advanced stages, and he wouldn't even let me drive to emergency. He had to call an ambulance and send me from the clinic to the hospital itself. So it was pretty scary. Actually, that was the main factor. What had occurred, being overweight and doing all the diets throughout my life, when I first started going to my primary care physician, I asked him about weight loss surgery, and he said, "Oh no, you don't really need it." And then when I became diabetic 2 years later, he did say that I needed to, due to the fact that diabetes could actually lead to early death. I was diagnosed with diabetes in late 2000 and early 2001. So from 2001, I was on medication, not having to take any insulin shots, but taking oral medication and doing the daily blood work for 18 months before I was approved and had my surgery. Well, once I got out of surgery, I was in recovery, and the doctor came to check on me, and at that point he said that I no longer needed to do any more medication for my diabetes. And so with him checking my blood work, and I had the Roux-en-Y surgery, I guess that's one of the benefits of having the surgery, is that this type of surgery is that it can reduce or get rid of diabetes altogether, which is the case for me. I've lost over 300 pounds. I'm at 289 and I fluctuate. And so I do my blood work at least yearly, and my blood work has, according to my doctors, have been really great. Just not to have that burden, because it was a burden that you had to take the medicine every day, and this was a life, basically for the rest of my life if I didn't have the surgery, and having to prick your fingers daily. I mean, I have a high tolerance of pain, but after a while you only have 10 fingers and it becomes a little painful at times. So it's actually such a relief, and I'm very happy that I was able to have this procedure and help me get rid of the diabetes.